Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Start off with Miss Brienna just kind of going into her non-traditional nursing skills.
Okay. So Raquel, it's great to connect with you again. I'm love that I get to collaborate with you and be on your YouTube channel. And I was excited when you reached out to me about this topic because I think, as you've stated, we have some common desires in wanting to help nurses kind of reach their unique and full potential in healthcare, right? So that could be them working at the bedside, or maybe getting an advanced degree, or maybe even gaining advanced skills that don't require the advanced degree and pursuing other jobs outside of bedside. So you asked me to describe what are some non-traditional nursing skills that I've gained. So I would say the skills that I've gained and actually am still growing and gaining are two major skills. And so that would be change management and project management. So I use the term change management very generally, because if you kind of Google change management, there's this whole official definition and all these probably nitty-gritty details about what change management is and how it's implemented. But I think that I would say I've had an opportunity to participate in change management generally as a nurse after transitioning from the bedside. So when I was working in the hospital, of course, I don't want to say you're not doing much, but the skills that you're implementing are physical skills. They're all the skills that you've learned in nursing school. So starting IVs, giving medications, documentation, communicating with patients, being a patient advocate on the unit, collaborating with the interdisciplinary team. That's not necessarily change management. You are monitoring that patient on that whatever the specific unit or floor that they're on to see them from admission to discharge. So when I say change management, in my opportunities working in an outpatient clinic, in a community health setting, and my opportunity working in a public health setting, in like the local health department, I've had an opportunity to collaborate with like the nurse managers of the departments that I've worked in, and also operated as a nurse manager for about a year. And so that afforded me an opportunity to really see the, I guess you would say, business structure of the clinic or that program as a whole. So change management, meaning, okay, what do we need to change to make things better, to make the patient flow smoother, to make sure that we're meeting the patient quota, or that the nurse practitioners are seeing the number of patients that the medical director wants them to, or even making sure that we don't take 1 or 2 hours, working with this patient who came in for blood pressure medication or a specific complaint with the provider. How can we make sure that they get their medical records after the visit when they're there, that has all the details of the visit, and maybe even educational content that they need to, when they go home, to figure out what they need to do to manage their care when they get home. Just all those little pieces of the visit with the patient from beginning to end. So I think that is a very important non-traditional skill that nurses don't typically have if they remain sort of in that hospital setting. Or maybe even, home health, they're still in that direct patient care setting if they're not the home health administrator or the nurse who created that home health business. So change management is one skill, and then project management. I guess you can kind of say they both would correlate, but project management would still kind of, you could correlate it to the same thing, but project management is really the act of planning, right? And executing those plans to see the end goal of that change management.
So I'm so, there with you when you're saying this. I'm just nodding my head, everything you're saying, because I think what many nurses don't have is the exposure, right? So nursing in itself, nurses make up the largest segment of healthcare professionals. So there's so much that we can bring to the table. It's so important for us to actually have these skills so that we know when to put those, when we know when to put our knowledge in action. So yeah. So now I do have a question for you. Who are some of the players, like the non-nursing players, that you work with every single day?
So I work with a data manager, the person who's responsible for managing the data, right? Gathering everything, maybe even creating the dashboard so that the rest of the team members can look at it, see what's going on, and then make decisions within our team, or even make decisions for the overall program itself. I work with an actual system super user. I've worked with a system super user. So that's the person who is, the expert and the go-to for the software that the end users are putting the patient data in. And then in the public health setting, I've worked with like outreach specialists. So folks that are going out into the field and interacting directly with patients who maybe cannot come into the clinic or be seen by providers at the time that they need to be seen. So a variety of non-nursing people. But of course, as nurses, we're still really central to that whole communication piece.
As a nurse, I have to actually develop really strong skills in managing the data because I'm responsible for interpreting the information. And oftentimes I have to actually report it, but you need someone to know the background of the data. Because my thing is really data without context is nothing. So when you have your nursing knowledge, you can make it connect, but you have to know what you're connecting to. So back to what you said about communication, can you communicate to someone if you don't understand their needs?
Because I graduated from nursing school about 10 years ago. I don't know how long you graduated, but I don't know if the nurses you were going to add.
Yeah, I graduated 10 years ago as well. Well, actually,
Okay.
11 years. 11 years
11
ago.
years. Okay.
Oh, wait a second. Ooh, 12.
Oh, okay.
That time is catching up on me. It's 12. Yes.
I wasn't too far behind you. So I don't know if the nurses now that are coming out of school are learning more about like advanced nursing while working on their bachelor's than we learned when we were in school, but I don't really recall a specific course or like a focus in nursing school where we did, maybe we generally learned like, okay, there's healthcare administration, there's these specialties of practice for nursing, and then there's these doctors that work in it. But I guess what I'm trying to say is I feel as though I've learned a lot after graduating and working in the field. And that's probably like with anything, right? When you get real world experience is when you really learn what you need to learn. But I still wish that there was some aspect of advanced nursing that we could learn while we're working on that initial nursing degree, because then that would really give us a foothold into how we want to specialize when we move forward, and specifically what we want to advance in. So that's why I really like your business, ACD4N, because it's a nice sort of like stepping stone, right? Without someone having to necessarily go back to school. But if you have someone who can act as mentor or as an educational consultant to help people understand and kind of like throw out verbiage and understand like the dynamics that fall under, whether that's, you know, informatics or other areas of practice, coding, you kind of can like figure your way through the muck instead of going to school and then realizing like, okay, I like this part, but not this part. So maybe I should have done this instead.
It's many business programs, they have externship programs because they want people to have that exposure when they come out of those business programs. So they, you know, if you want to go to a JP Morgan and Chase, if you want to go to one of you want to go to one of the big, you know, the big companies, you can go there and kind of still feel that you kind of understand the way their operations go. But with nursing, oftentimes the only operation we're constantly being told that we have to understand is the operation of what's happening in the hospital. And that's the reason why these conversations happen all the time. This conversation,
Yeah,
the conversation we're having now, you
it's
will
not
always
new.
hear this conversation.
Yeah.
And it's going to be, I think it's conversations like this are going to become more and more common
Mhm.
as nurses learn more skills and they continue to move away from the bedside, because you're going to have nurses that tell other nurses, like, you don't have to stay there. Like, if you
Yeah.
don't like that job, you don't have to be there. There's more
Mhm.
things you can do in nursing.
Yeah.
Mhm.
Yeah. There was I think it was a TED talk that I watched recently, and it was a young guy, and he had some other jobs prior to becoming a nurse. I can't remember specifically what they were, but the TED talk was about how he believes in nursing school, when you're getting your initial nursing degree, they should have a course specifically about like nurses and their role in innovation, or their role in, could say, change management, and how that should be an additional class, right? And add a clinical onto that. So we do clinicals because we're in nursing school and we need to learn how to give a shot, or, you know, literal hands-on skills. We need to do that appropriately. We don't want to bring any harm to patients, but we don't really have, and then we shadow, right? We're going to different areas to understand where we can be a nurse in different areas of the hospital or home health. Because for me, it was nursing home and then the hospital. There was no other setting that I didn't even do a rotation in. Did I do a rotation in public health? No, I don't think I did. We had a public health class, but we didn't do a rotation in public health. But all that to just say, I really appreciated his TED talk, because I thought, why haven't we done that? Why didn't we have that class where it was like, okay, here's the change management, project management, business side, and the different things you can do within it. You know, this is advanced nursing. So after you go out there and do your 2 to 6 years, 2 to 10 years, however, these are some degrees that you could do and what you might do in those degrees.
Now, there are some thought leaders that are coming out and they're really pushing the envelope. They're really getting things out there. Bonnie over at Penn, Rebecca Love, she did a great TED talk about 4 or 5 years ago about nursing innovation and talking about the hackathon, the nurse hackathon. So, I mean, there's definitely nurses out here leading the charge and, you know, want nurses to become more familiar about finances, want nurses to be more familiar about innovation and being creative and thinking out of the box. But I just feel like there's just not enough nurses who have a seat at the table who can push those conversations and who can implement those type of changes and, you know, raise the standard for nursing, that actually have the I don't know what if I want to say drive or desire to push those conversations. It just seems like it just, honestly, I always see nursing burnout as something that they'll be more quicker to talk about. And oh my God, there's so many nurses leaving the bedside, but very little conversation about, well, here is the changes we're going to make to the nursing curriculum. Like I'm waiting for that article to come from the AACN, right? Where they're saying, you know what, we're going to be pushing these changes so that the new nurses that come out, they're prepared for the current workforce, because the current workforce is so competitive. It's not just you needing those soft skills, you need those technical skills. But here it is, somebody coming from the IT world, right? Saying, hey, we could just use predictive analytics and work it out for it to stick on the chart. And, it doesn't work like that when you think about human beings that actually need to see their doctors. A person who's diabetic, they need to see a doctor for what? Nurses can run that down for you. Podiatry, eye care, right? They need to get their labs done. I'm not expecting somebody in IT to understand that.
Yeah.
But this is the thing about nurses, where I'm going to always encourage nurses, you need to build your skills up, because when someone says something like that, you shouldn't nod your head and say, oh yeah, that makes a lot of sense. You should be able to proudly speak up and say, you know what? I understand why you're coming from that perspective. Let's collaborate, right? Not that the IT person is so ignorant and they don't know anything about healthcare, and not that I'm nurse know-it-all, right?
Yeah, of
We need to
course.
collaborate so that I understand where you're coming from with your technology and your knowledge, right? And you understand where I'm coming from with why we need to actually take care of these human beings, right? Because without that, we're actually not solving the problems that we have in healthcare, which is to improve the quality of care. So I am going to have you give your final word as far as any skills you think nurses should challenge themselves to develop if they want to advance in non-clinical or non-traditional nursing roles.
Yeah, sure. So I think that some crucial skills, and I'm not going to name any specific skills. I guess I'm just going to generalize it. And we've kind of touched on it already, but I think that having some kind of business acumen, whether that's, like you said, learning Excel, being the person that likes to crunch numbers. Not everybody likes to do that, but maybe learning how to crunch numbers, or being adept in statistics, public speaking too, to be able to present effectively, communicate, answer questions on the spot, to be a leader, to communicate effectively. So I think that also falls under having business acumen. Developing the thought process to think logistically about healthcare, or like where you are at that point in time, developing the skills to look at things holistically. I think that's part of business acumen as well. Maybe somebody doesn't necessarily want to go into business for themselves, but if you're thinking about advanced nursing, then you are operating in some form of organizing a business, or managing a business, or managing the people that are part of a business. It's all moving pieces that contribute to a business. I think learning maybe what specific skills are required under a business acumen is crucial to just becoming a better you and a more unique you, and contributing to healthcare the way that you deem best.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com, or visit our websites www.advancednurses.info or www.acd4n.com.